Hi, it's Chris again, the RCPSG Trainees Committee representative. This is the fifth in a series of videos created to help you become familiar with the new Internal Medicine Stage 1 curriculum. This video will focus on the different types of structured feedback that you will be expected to receive during the training program. The first feedback form we will discuss is the Multiple Consultant Report, MCR. This is likely to be a new concept to you as it is not something you would have come across during foundation training. The MCR provides structured feedback from consultant colleagues about your performance in clinical practice. It is much more detailed than multi-source feedback, so needs to be performed by consultants that you have worked closely with during your clinical attachments and on the acute take. It is the main source of evidence that feeds into the all-important Educational Supervisor Report. This is because in each MCR, the consultant will provide their own rating for each of the 14 capabilities in practice, or CIPs. These ratings from multiple consultant colleagues will help your educational supervisor make their decision about the appropriate level of entrustment to assign in your ESR. You need a minimum of 4 MCRs, and more importantly, each of your clinical supervisors must complete one. This means that 3 of your MCRs will be completed by your clinical supervisors, leaving at least 1 available for another consultant to complete. However, we strongly advise obtaining more than the minimum number, particularly from consultants you have worked with on the acute take and possibly outpatients. This will give your educational supervisors much more information when constructing the ESR, enabling them to make a more accurate assessment of your capability. MCRs are completed by sending a ticket request to the relevant consultant from the e-portfolio. However, it is always good practice to discuss with the consultant in advance of sending the ticket, so it does not come as a complete surprise to them. More details on how to do this can be found on the Guide to e-portfolio video on the Internal Medicine section of the JRCP-TB website. You should be familiar with multi-source feedback (MSF) from foundation training. The MSF provides feedback covering areas such as communication skills and team working, and is particularly useful for evidence of your progression in the generic CIPs. Like MCRs, MSFs must also be completed via a ticket request sent from the e-portfolio. You will need at least 12 colleagues to perform an MSF form, which should include 3 consultants and a mixture of clinical and non-clinical staff. Clinical staff includes nursing colleagues, pharmacists, physiotherapists, speech and language therapists, and occupational therapists. Non-clinical staff include ward clerks, ward housekeepers, medical secretaries, and discharge facilitators. Your educational supervisor must approve the list of your proposed raters to ensure that you have an appropriate mix. 1 valid round, consisting of 12 or more responses, is required for each year of IM training. We suggest sending requests to more than 12 people in order to ensure you reach the required number if some people do not respond. Once you have the required number, your educational supervisor can release the summary MSF on your e-portfolio for you, and crucially the ARCP panel to review. There are 3 other types of feedback that can be obtained and are useful to your training. These are the Quality Improvement Project Assessment Tool, the Patient Survey, and the Teaching Observation. The Quality Improvement Project Assessment Tool is an assessment of your ability to complete a quality improvement project or audit cycle. You need to have one of these assessments performed by the end of IM Year 2. This is a mandatory requirement that is outlined on your ARCP decision aid. Please note, you also need to have some evidence of involvement in a QI project during your first year of IMT to progress through that ARCP. The patient survey allows you to gather feedback from patients you have seen, usually in outpatients, to use as evidence of your behavior in clinical encounters. This is not mandatory, but can be used as evidence of development in the clinical CIP4 and some of the generic CIPs. This survey can be downloaded from the document library in the JRCP-TB website. You can then upload the completed surveys to your e-portfolio in the personal library and then ask your educational supervisor to produce a summary form which will be saved in your e-portfolio. Finally, the teaching observation is another form of feedback and is used specifically to assess your ability to deliver a teaching session effectively. It can be performed by a consultant or registrar in any formalized teaching session. Like the patient survey, it is not mandatory, but can be used to demonstrate competence in generic SIP 6. Thank you for watching this video. For further information, visit the JRCP-TB website, where you can find the full curriculum, the rough guide to IMT Stage 1 training, a guide to using the e-portfolio, and a section of frequently asked questions. If you have any other queries, you can contact us using curriculum@jrcptb.org.uk or via the JRCP-TB Twitter account.